How is everybody? Okay, make sure I can hear you. How is everybody? Oh, all right. That sounds much better. Well, welcome to the fourth annual Medicare expert panel that the Seniors Council here is hosting today. My name is Gretchen Lopez. I'm the vice chair of the Seniors Council, and I'll be introducing our distinguished panel members in just a minute. I did want to do a few announcements. First of all, to thank the Rock Church for their generosity in providing this wonderful meeting space for us, and to let you know that the Seniors Council is an all-volunteer organization advocating for people who are 60 and older residing in Douglas County. And we advocate for you a number of ways. We do educational programs. We collaborate with our community partners like the Rock Church. And of course, we have our distinguished guests from the federal and state office and also private industry. So we're going to get started here. I'll introduce the speakers. Our first speaker is going to be DelPizzo. Dennis works for the Centers of Medicare and Medicaid Services, also known as CMS, in the Denver office. As a health insurance specialist in external affairs and media relations, his primary responsibilities include coordination of CMS's regional outreach and education for the 6-state region. He has worked in the Medicare field for over 29 years. Our next speaker is Kim Latta. She's the program director for the Colorado State Health Insurance and Assistance Program, also known as SHIP, that's a P at the end, which is the education arm of Medicare. SHIPs provide accurate and objective information to all Medicare beneficiaries regarding their benefits and their rights. Additionally, Kim has trained volunteers who will assist individual Medicare beneficiaries with their specific situations. Kim also is the director of the Medicare Patrol Program, which combats Medicare fraud and abuse. And our last speaker, Shannon Sheppard, is an outreach specialist with KePro, Inc. KePro is a company contracted by Medicare in Colorado and other states to administer its quality of care program. It also handles the investigation of possible premature patient dismissals in hospital and skilled nursing care settings. Please help me welcome our speakers.
Thank you very much, Gretchen. Thank you for coming out this morning, and we really appreciate it. It's very important that we have the opportunity to, or that you seek the information that we want to provide to you. And we want to talk to you a little bit about the Medicare open enrollment period that is occurring right now, as everyone knows, and it's going to be hard to miss it. Being on Medicare, it runs from October 15th through December 17th. It's an annual event, and that's the one time, and we do encourage it. CMS's encourage it. The SHIP folks encourage it, but we can't emphasize enough that Medicare Advantage plans, Medicare prescription drug plans, which all or some of you probably participate in, these are private companies, and they make business decisions on an annual basis. And so that's why it's important to see how plans change, both costs as far as associated with premium amounts, and also cost-sharing amounts, deductibles, co-insurance, et cetera. And just like, remember when we were working and how our health insurance was subject to change on an annual basis? Same thing with original Medicare. Medicare changes on an annual basis. 2019 Medicare cost information as far as the Medicare premiums for next year and out-of-pocket costs associated with the original Medicare program was just released in October. And so that information is available too, and I'll have handouts at the back table afterwards for anybody who desires that information or is not aware of it too. But that lists like what is going to be the standard Part B premium for next year, and it's going to be $135.50, up from $134 this year, and I'm talking about the standard base premium. Medicare premiums are subject to income, so we look at a person's adjusted gross income. We actually look at modified adjusted gross income, and people with Medicare that have higher incomes, greater than $85,000 or greater than $170,000 for a couple, can pay a greater share of the Medicare Part B premium. It's a law that Congress passed back in 2007, and then they did the same thing to Part D prescription drugs in 2011. And it's a program. It's Congress saying, yes, we want higher income people that can afford more to pay a little bit more in Medicare costs. And so that's what that's about. But the 2019 cost sheet that I'll put back at the back table will have that information available. Just to talk a little bit about the Medicare open enrollment period, like I said, this is that one time each year that we want you to look at if you are a member of a prescription drug plan, and most people are. I was just looking at enrollment numbers, and there's 43,354 Medicare beneficiaries in Douglas County, and 75% are enrolled in a prescription drug plan. And so what that means is that the other 25% probably have access to other forms of coverage, VA, TRICARE, access to benefits through their former employer for retirement benefits. But most people have some form of creditable prescription drug coverage when they fully retire and are on Medicare. And so these plans change, and that's what we're saying about. And at the end of September, 1st of October, you should have received an annual notice of change listing how that plan, what the significant changes will be to that plan for next year. Take a look at it. Make sure things haven't there haven't been any big changes as far as costs, not only premiums, but out-of-pocket costs, the drugs that they cover, the pharmacy networks that are that the plans work with. It's just very important because you might be able to get a much better deal by shopping around. And that's why we say this, is that maybe your plan hasn't changed significantly and you're happy, but you can get the same or very like coverage with better coverage at a lower cost, and that's why we want you to look. In addition, Medicare is promoting, and we're not changing in any form because we know some people absolutely hate using computers or getting on the internet. Some people love it. But Medicare is emphasizing an e-health initiative that will only improve over time. And we launched a couple new tools. One of the new tools is a compare coverage tool that allows people with Medicare to maybe first start on a self-help path as far as saying, what are, and the tool asks you 5 important questions that are considerations that you want to take into account when you make the important decision of what's right with me, or what's right for me as far as my health insurance and drug coverage. But the compare coverage tool is going to ask you 5 important questions, and then it will help you decide which path you might want to go, original Medicare or a Medicare Advantage plan. And with prescription drug coverage, or maybe original Medicare with a Medicare supplement and a standalone prescription drug plan. But that tool is designed to help guide you in a path based on the way you answer the questions of what might be right for you. And it might be a good point for you to then have do some research and education before you contact the SHIPs, or before you contact 1-800-Medicare to get maybe additional help or to seek questions. We always encourage you to ask your healthcare providers, your families and friends, your neighbors that might have experience with a particular company as far as how well it works for them. So there's what we encourage is active consumer information and education, so you make the best informed decision that's right for you. Because this might be the only time each year that you can change your plans. And there's also a Medicare, as part of that e-health initiative, there's also an estimate Medicare cost tool that allows you to compare what approximate costs might be. And again, these are new tools, and we're going to continue to refine them. But they're going to allow you to compare original Medicare costs with the Medicare Sup and a Part D plan to Medicare Advantage, which almost always includes prescription drug coverage, and allow you to see what my approximate out-of-pocket cost might be based on the information that you provide to the tool. And again, we'll continue to refine those, but they're a great resource for self-help. Then Medicare Advantage plans for next year. And just to let you know, in Douglas County, as I said, the 43,354 people that have Medicare, 43% are enrolled in a Medicare Advantage plan. The remaining individuals would be enrolled in, that'd be what, 57% would be enrolled in original Medicare here in Douglas County. And of the plans offering coverage next year, people in Douglas County have an option of choosing between 7 organizations covering 27 different types of plans. Premiums can range for a Medicare Advantage plan anywhere from $0 to $195, depending on a plan that's right for you and that you zero in on as far as meeting your particular needs, as far as doctor, cost, coverage, convenience, if you travel quite a bit, etc. But it allows you to zero in on what might be right for you. And healthcare is so individualized and unique. What's right for this gentleman, it could be very different for this lady, for this person, for this person, for this person. It's very unique and individualized. And so it's very important that we each look and actively compare. And then Medicare Advantage plans, and just to let you know, as far as the Medicare Advantage plans, in addition to the $0 to $195 of those 27 plans available, the annual RX deductible is anywhere from $0 to $225 for those plans. So that's why it's important to see what plans might be right for you and the costs associated with that. And then the maximum out-of-pocket costs on a Medicare Advantage plan for the plans in Douglas County range anywhere from $3,900 to $6,700. So what the maximum out-of-pocket cost means is once you reach that threshold, if you would, then the plan would pay at 100% after that. That's what catastrophic or maximum out-of-pocket cost means. And then star ratings, quality, I didn't mention this, but quality can be another factor you look at as far as evaluating a plan that's right for me. And quality ratings can be anywhere from, we evaluate Medicare Advantage plans and prescription drug plans on an annual basis and look at how well they perform, take care and treat certain conditions, complaints, how they resolve those complaints. All of you that are possibly a member of those plans, member satisfaction surveys and how you rate the plans. And we score those each year, again, for your use in evaluating and maybe using in your decision making. And plans in Douglas County range from 3.5 to 4.5. And 1 being the lowest, 5 being the highest. So you have lots of options and choices, bottom line. And then the prescription drug plans, the standalone Part D plans, if you go down the path of original Medicare with a Medicare supplement and a standalone prescription drug plan, there's 10 orgs, 10 companies offering 26 plans. Premiums range from $1,620 to $113.26. So you can see there's lots of combinations and options for people. That's why it's important each one of us look. And the deductibles can range, the drug deductibles can range anywhere from $0, and there are 7 plans offering $0 deductibles here in Douglas County, all the way up to the maximum that a drug plan can charge next year for a deductible of $415. So you can see there's lots of options and choices and combinations. And then star ratings for the standalone prescription drug plans in Douglas County range from 2 to 3.5. I think the last thing I'll leave you with is the Medicare Advantage plans, and we've given them some additional flexibilities in how they offer supplemental benefits. And supplemental benefits are services that original Medicare doesn't cover. So on the Medicare Advantage side, again, these are private companies that have contracted with Medicare as an option and a choice for Medicare, all people with Medicare to choose and determine which one might be right for you if that's your choice, or if you want to stay in original Medicare, that's perfectly fine. But in the Medicare Advantage plans, these companies can and do provide additional benefits that original Medicare doesn't cover. Limited vision, limited dental. They might provide benefits for other, like health club memberships. Well, we reinterpreted the regulations regarding supplemental benefits, and the health plans might provide additional supplemental benefits, and that's why it's important to look and see what additional benefits might be provided for a particular plan I'm looking at. And we allow the health plans in 2019 to also provide different coverage, different types of coverage for people for certain chronic conditions, diabetes, congestive heart failure. And what the coverage might be is it might provide lower cost sharing and additional benefits for those individuals with those chronic conditions to better manage and take care of those individuals. So we're providing plans with additional flexibilities. And then the last thing, and then I'll turn it over to Kim, is there's going to be, for people that are enrolled in a Medicare Advantage plan as of the end of the open enrollment period. So 1/1/2019, you have told us, or you remain in a Medicare Advantage plan because that was your option and plan of record in 2018 and you didn't change that. If you are in a Medicare Advantage plan, there's going to be a new Medicare Advantage open enrollment period for the first 3 months of next year. And so what that means is if you have a Medicare Advantage plan on 1/1 and say on the 15th, you say, oh my God, my provider, I failed to check that. My provider is not part of this plan anymore. You could change that. And you have from January 1st through December 31st, but the key is you have to be in a Medicare Advantage plan to exercise this option. If you're in original Medicare and only have a prescription drug plan, you're not going to be able to exercise this enrollment option. And then the last thing I'll leave you with is resources. And number one, I was telling you about the self-help tools. That's on www.medicare.gov. 1-800-Medicare is a great resource, 24/7 service. And then also local help in the community, and that's what Kim is going to talk about next. So I'll turn it over to Kim. Q&A, okay. Any questions? Anything that I covered? Or anything that I didn't cover that you just have concerns or questions about? Yes, sir. Thank you. If you take no action in the open enrollment period, do you stay in the plan you're in? You do. Unless that plan notified you that they're no longer doing business next year, your coverage remains continuous, and you will roll into that same coverage into 2019. So that's correct. Was there a question here? Yeah, so the age for Medicare, and there's 3 eligibility points for Medicare, and Medicare's age has not changed, unlike Social Security eligibility for full retirement. Medicare, people are eligible for Medicare at age 65 or over, and then we can have people under 65 that are eligible for Medicare. And people under 65 are people that are receiving Social Security disability benefits for 24 months. On the 25th month, they become automatically eligible for Medicare. People with Lou Gehrig's disease, ALS, can qualify immediately. And then people with end-stage renal disease, permanent kidney failure, can qualify for Medicare. So there can be people under 65 that qualify and that are eligible for Medicare. Of course, the age 65 people are the predominant group that are enrolled in Medicare. Was there another question? Yes. So her question, I mentioned there are 7 organizations offering 26 different plans if Medicare Advantage was her choice, or there's 10 organizations offering 26 different plans if she just wanted a prescription drug plan. How does she go about beginning to whittle that down to identify what's right for her? And that's a great question. Number one, you can start right here. If you are on Medicare, you would have received this in September. And in the back of this book is a listing. Okay, okay. So if you just relocated here, and she did say that, she just relocated here, so she's new to Douglas County. So you would begin to evaluate it first. You could use that compare options tool on Medicare.gov, and you'll see if you go out to www.medicare.gov, you'll see 3 prominent buttons right at the top of the Medicare.gov homepage. One of them is compare health and drug plans, and that allows you to say, enter your zip code and zero in on, enter your zip code, and then you can either do a personalized search or a general search to begin to zero in on these companies. And then you can start entering your prescription drugs if you want to, dosage, frequency, a pharmacy that you might be using, and then that allows you to zero in. And then you can also compare health memberships. If you're looking for Medicare Advantage, you could select that there's a radio button as far as what do you want to compare? Medicare Advantage plans with drug coverage or without, or prescription drug plans. You can click on that. And then you might have questions after you get this comparison report and it spits out as far as interpretation. That's where Kim's staff can help, and they're called the State Health Insurance Information and Assistance Program. And Kim will provide contact information for her program, but they can provide resources as far as interpreting those results. If you have questions, maybe you're able to answer your own questions, and we encourage self-help. But if you have questions, that's where you can go. 1-800-MEDICARE is available 24 hours a day, 7 days a week if you have additional questions once you get that. But that's how we start. This is a great resource. For her, it doesn't apply because she got her book in Texas. She just relocated, so she didn't get the Colorado version of the book. And then either the self-help route, or you don't want the self-help route, you want to go right to help locally in the community. And for you that received the Medicare New Handbook, the Colorado edition, there's a prominent number on the back center of the handbook, which lists Kim's program, the Colorado SHIP program, and also 1-800-MEDICARE. So that's the best way that she would go about whittling down and finding what is right for me. And I was going to say too, on the Medicare Advantage route, if you go the health plan route, you can see once you select and say you narrow it down to 1 or 2 or 3 companies, and you're going the health plan route, you can see what networks that plan offers as far as providers, physicians, nurse practitioners, physician assistants. Ask your healthcare providers too before you make the ultimate decision. That's a great resource too, or the billing and office managers. They can also be a great information source for you. I think you had was there a question up here? Yes, sir. Yeah, so the interface between TRICARE and Medicare has not changed. At least I can't speak to TRICARE, but if you're eligible for Medicare A and B, you're going to get a notice from TRICARE informing you that you have to enroll in Medicare Part A and B, and then TRICARE acts as a supplemental payer, and they also provide drug coverage, and that's the interface between TRICARE and Medicare. As far as any changes with TRICARE, always seek that out and make sure that there are no changes or nothing that you need to do special. I can't speak for them. I can only speak for Medicare. Was there? Yes? As far as the people that know the program, if you're talking about, because one of her questions too that I failed to mention is, do I have to seek out an agent and broker? Well, yeah, you absolutely could. And if you have a established relationship with an agent and broker, they can be a great resource. Now, along those lines, they could steer you. They might be working for one or a couple particular companies, so they might have financial incentives to steer you into their products, as that is the product for you, even though if they're reputable, established relationship, they're going to probably do what's right for you. But that's where, like the SHIP program, 1-800-Medicare people, they're never going to steer you. They're never going to say XYZ is the company. Never. They are neutral, unbiased. They're never going to steer you. The ultimate decision is always going to rest with you. They're going to throw out the considerations, options, once they listen to your particular story and situation and what's right for you or what's important to you. But they're never going to influence you or steer you. That they are neutral and biased. We are neutral and biased. We don't recommend any one company over another, but that's where you have a lot of options or a lot of resources to compare that. The Plan Finder tool, the quality ratings, checking with your friends, neighbors, relatives. Some of them might be reputable and reliable as far as the information they're providing. Some of them might be highly influenced for one reason or another. Checking with your healthcare providers, that can always be the best resource too. And then the SHIP folks and the 1-800-Medicare folks are constantly trained too. So they're there to provide you the best information based on the questions that you're asking them.
Okay, let's move on to Kim. You'll have an opportunity to ask Dennis additional questions at the end. So if you have any, just jot them down. Thank you.
I'm going to come down here as well. I feel too far away up there. I just wanted to make two extra comments on something that's already come up. One is, don't assume that if you have a spouse, that the plan your spouse chooses is best for you. When we're talking about prescription drug coverage, we need to look at your individual needs and the medications that you take. And so it might mean that each of you have a different plan that best meets your needs, okay? And then there was another comment on, do I need to do anything if I'm happy with my plan? The answer, what Dennis said, is right. You don't have to do anything. You'll stay in, but you would have received a notice from that insurance company telling you about any changes to your plan that you're in for the upcoming year. So make sure you open your mail and read that and take that into consideration before you decide to stay put. Okay, so lots of resources out there. I'm going to share what I have on the table out there. I'm Kim Latta, and I work for the state of Colorado at the Department of Regulatory Agencies, otherwise known as DORA, in the Division of Insurance. And we regulate insurance companies in the state of Colorado, as well as the people who sell insurance in Colorado, the agents. And so two things we do is process those licenses and applications and, again, regulate those companies, but also we have a consumer section, of which I'm a part, that help consumers, first of all, understand the products they're looking at, and then process any complaints that come in. The policy didn't pay as it should have, for example. So you can get to us a couple of ways. You can go online at the DORA website and file your complaint there or your request for information. Most cases, it's going to come to me if it's Medicare related, and my staff, I have a very small staff at the state office. We can answer your questions, but I also want you to be aware that there are local counselors, SHIP counselors around the state. So the blue and white card that's out on the table about SHIP that says confused about Medicare and gives you a toll-free number, then it's going to ask you when you call that number what county the beneficiary lives in, whether it's you or somebody else, and we'll route your call to the office closest to you in your community. And often folks like to do that because you can make one-on-one appointments and go see or go to Medicare 101 classes if you're new to Medicare. Not that we can't help you at the state office, but we do better with the complaints that come in, right, than the day-to-day communication. We're happy to help you over the phone. We rarely meet with anybody in person. We're downtown Denver. It's very hard to get there. And so we'll do it, but I really want to encourage you to utilize those local programs. we are a state agency, so, and we're talking about Medicare, a federal health insurance program. So you wonder how that connects. For the most part, we, again, have to rely on CMS to explain Medicare and to tell us what's going on with it. And we're just regulating the companies in Colorado, and we're regulating the people who are selling products. But generally, we're going to go back to the CMS regulations and rules about how things have to work. But we do receive a federal grant that comes to the Division of Insurance that runs this program called SHIP. It's a national program. Every state receives funding. And that's why we do the Medicare counseling piece at our office and throughout the state for this federal health insurance program. Hopefully that's clear. So we'll always reach out to CMS. If it's something we can't do and there's something going on that doesn't seem right, we will always reach back to CMS because they might have the oversight rather than the state of Colorado. So the blue and white card has that 800 number. If on the back of it, if you have someone who needs bilingual services in Spanish, that is contracted out to the Boulder County Area Agency on Aging for the whole state. It's a different toll-free number, and someone can call and speak to them in Spanish about their Medicare needs. So just wanted to call your attention to that. So Dennis talked about resources, and he talked about the Medicare and You book. The Colorado-specific one does have plan information. Another place, I brought you a newspaper with the same information, so you can look at it. What you need to know about this newspaper is the plans that are listed in here are those that are available for large areas in Colorado. There's some tiny plans that we typically don't include because don't want folks to get excited that there's an option there that doesn't apply to them. And also, we only list, since this is a prescription drug, a Part D newspaper that we put out every year, it only lists plans that cover drugs. So there are lists in there of the standalone prescription drug plans, Part D prescription drug plans. There is a list of the Part C Medicare Advantage plans that include drug coverage. And then there's another chart in there for the special needs plans, which are a specific type of Medicare Advantage plan for specific populations. Sometimes it's diagnosis related, sometimes it's for dual eligible Medicare, Medicaid folks. But this has everything Part D. You can read from the beginning, what is prescription drug coverage? You know, who's eligible for it? What's available in Colorado? Why would I do this versus that? What if I have limited income and resources and want to apply for a Medicare savings program for regular Medicare or low-income subsidy for Medicare prescription drug coverage? So there's, from front to back, it's a good read, and it's in newspaper format. So they're out the back table. If somebody would like extra copies, I'd be happy to share them with you. So Dennis talked a lot about what SHIP can do as far as helping you compare options. Again, if you want to go online to Medicare.gov, you can put in your zip code and get exactly the plans that are available. Or you can call a SHIP counselor, and we'll put your information in for you, and we'll talk about what's available out there. And generally, that's a shopping process, right? Evaluating your coverage, seeing if what you have is still a really good fit for you. And he mentioned cost. Although I know cost shouldn't be your only driver, you know, just because it's cheap doesn't mean it's better. But if we're talking about just a prescription drug plan, you really want to consider, why wouldn't I choose this plan that costs me less that does the same thing? When you get into Medicare Advantage plans, it's a little bit more complex than that. We look at provider networks, you know, what doctors are in there and all of that. But for just a standalone prescription drug plan, almost always, when we put someone's medications in and the pharmacy they like to use, we can almost always find a plan that might save them money in the coming year should they want to choose. So again, your choice, but it's worth looking at, as Dennis said. And I encourage you to do that each year between October 15th and December 7th for a January 1 effective date. So assuming everybody does what they're supposed to, that's what the SHIP program is about. The other program that I oversee is called Senior Medicare Patrol. And we get federal money for that as well at the Division of Insurance. And its specific goal is to help prevent Medicare fraud and abuse and waste. Billions, with a B, dollars are lost in Medicare every year due to fraud, abuse, and waste. And so I'll tell you up front, it's very hard to fix those things when they go wrong. You know, somebody does something bad, it's very, very hard to get those cases resolved in a way that we feel is timely and helps the beneficiary. So always, 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 we want to prevent bad things from happening, wrong things from happening. And the way that we do that is through all of you. So the beneficiary is going to be the first person that sees something, and maybe that's some agent trying to sell you something in a way that you know they shouldn't be doing. You would know that by the handout on the back table called, well, it's a two-column, a red and a green column. We used to call it agent do's and don'ts. It tells you what's prohibited by an agent or broker when they're selling a Medicare plan and what's allowed. And so if you notice something happening, we would want you to report that to us if it shouldn't be happening. And things have changed a little bit from year to year about what's allowed and what's not allowed. But in general, I just tell folks, listen to your gut. If someone's trying to do something, right, that you in your gut is telling you, this doesn't seem right, you know, that they can do this. We get a lot of those calls. Is this okay if somebody does this? We love those calls, right? Because that's you paying attention to behavior, someone trying to often take advantage of a Medicare beneficiary. They're very slick. They're very good at what they do. And this is not just agents. This is people trying to get your Medicare number from you, right? Trying to sell you a service that is not on the up and up. I tell folks all the time, if you're invited to a group setting for a Medicare service, something's wrong, right? Something should raise your doubt on that. Medicare is a healthcare system that is medically based, right? It's medically necessary, any services you get. So if you get people saying, everybody come, it's all covered, right? If you're on Medicare, you're good. Come and we're going to bill your Medicare for it. That should really raise your attention. This is an individual medically necessary service through Medicare that should legitimately get paid. So we see people gathering folks up to swab their cheeks, to do genetic testing. We see them come to vans to do kind of wellness screenings that aren't always on the up and up. We see back and knee braces being advertised all over the place, in the newspaper, on the radio, on the TV, right, telling you if you're on Medicare, you're entitled to this and you don't have to pay for it. So anytime you hear that come one, come all kind of message or urgency, you have to call now, you know, do it in the next 20 minutes, you should know all of those are someone trying to get you to do something that you probably don't want to do. So we have a program called Senior Medicare Patrol, and this is where you would report this. This is my office. My staff answers this phone directly, unlike the SHIP program that goes out to the local counseling programs. It's a different 800 number. And we appreciate when you call and say, I saw this happening, is that okay? They promised me Medicare was going to pay for this. They're using the Medicare card to advertise, or the Medicare name to advertise. You get mail, right, that looks very legitimate, that looks like it could be from the government. When you get those things, we want you to report them so that we can, and the division can look into anything we have jurisdiction over, and we can share that with the CMS office in Denver to see if somebody's done something wrong. Always wait. If you have any doubt, always wait and ask questions before you do. We used to get the buyer's remorse calls, right? I just did this. Somebody called me and tried to talk me into something, and I knew better, but I told them my Social Security number or my Medicare number or my date of birth, and this kind of remorse calls. More and more I'm getting, someone tried to do this, and I didn't fall for it, but I thought you should know it happened. So we can sometimes do things about what they're doing, but the best recipe is you to just prevent it up front, right? Because think about this. If someone calls you and tries to get your Medicare number and you don't do it and you hang up like we tell you to do, right? Don't have a conversation with them. Don't explain why they shouldn't be calling you, right? Hang up the phone. Then if you report that, you have very little information to give me, right? Somebody tried to call me. I didn't fall for it. Click, right? So I can't really do much with that, but that's okay because we've prevented it from happening. If they keep you on the phone, they're going to get something from you. My best story is with my stepmother, who they called and tried to get information from her, and she started into this. I'm from New York City, and I wasn't born yesterday. I was born in 19, right? And you can't convince me this, blah, blah. And she told them all this biographical information while she's telling them off, right? So don't do that. Even though you want to do that, hang up the phone and then yell at the phone, right? We don't want you talking to them. So you see, we want you to prevent. If you have something to tell me, that means probably something bad's happened and we have to try to fix it. But these cases take years and years and years sometimes. And again, never really to my satisfaction are they settled. So just wanted to say that. Okay, and finally, the Medicare cards. Did you mention these? The new Medicare cards? Okay, good. So in Colorado, those who had Medicare prior to April are getting a replacement card. If you came on Medicare since April, you got the new card as your original card, right? But prior to that, we had a different card, and it had some personal information on it, right? Your Medicare number was based on a social security number of you or maybe your spouse. It had a signature on it, your sex, some other things. So they have decided to replace that card with a safer card. So everybody in Colorado should be getting their cards now. They started mailing here about 6 weeks ago. If you don't have yours, I would say in the next 2 to 4 weeks, you might want to call and check to see if something happened with the mailing. You may not have had a correct address with the Social Security Administration, and that's the address they use to mail the cards. What I want you to know is the cards can be used right after you get it. For a while, both your old and new card are going to work. Once you use that card and it works well for you, I want you to shred your old card. The old card has that Medicare number with the Social Security number in it, right? If you lose that and it's got your, your signature and things on it, you don't want that to be lost, just like your Social Security card, right? So find your old red, white, and blue Medicare card. When you get your new one, try it out. When it works, shred your old card. If you have a Medicare Advantage plan, you're not on original Medicare, you may not use your red, white, and blue card when you go to the doctor. You'd use your plan card, but you still need to keep this card. Put it somewhere safe. You might need it in the future if you ever disenroll from that plan, right? And you still want to shred your old card if you can find it. Hopefully you can. Okay, I'm going to stop there so Shannon can talk. Anybody have questions that I could answer briefly? If not, we'll have another Q&A at the end when Shannon's done. So,
Any questions for Kim right now?
I got 2 cards.
back to back. Do they look exactly the same? Okay. So they have 2 cards that look exactly the same. I've heard that from a few people. I always tell people to use the most recent one because occasionally they were different. If some change happened in the interim when all this huge mailing, all these millions of cards was going out, something happened, sometimes the second one looks a little different, and that would be the most current one, so I would say use that one. If they look exactly the same, you can keep them both in a safe place, right? Okay, yep. Anything else I can answer quickly before Shannon? And then we'll come back, and as you think of more questions, I'm happy to answer them, or I can stay after and talk to you as well. Okay?
Come see me, but you're fine. That should be a identical chart. There's a small no contractor issue that we caught right away, and that's why we received the card. But it was a small number of people that no identity that doesn't get happen.
All right, good morning, everybody. My name is Shannon, and I work for KePro. So this morning, we've been talking about Medicare coverage. Both Dennis and Kim have covered, different elements. But right now, we're going to shift gears, and we're going to talk about some services that you guys have as a Medicare beneficiary. And that could be, you can have the original or the managed care plan. It doesn't matter. It's going to be, these services are available to you, and they're also free. So I work for KePro, and we are the Beneficiary Family Centered Care Quality Improvement Organization, or BFCC-QIO. And there's 2 of us organizations across the nation. And the services that we provide are if you're in a hospital and you get a notice that you're going to be discharged, you have the right to appeal that. And I have some handouts you guys see this out there? I really recommend that you guys pick this stuff up because this really explains your rights in these situations and answers kind of the common questions. We also handle what's called discharge appeals. So when you're in a post-acute care setting, so if you're in an outpatient rehab, you're in a home health, you're in a skilled nursing facility or hospice, you're going to get what's called a notice of Medicare non-coverage. And that, again, is stating that, okay, these services that you're receiving, these are now ending, and again, you have the right to appeal. We also handle what's called immediate advocacy. And so this isn't like a formal complaint, but let's say you're having difficulty finding a primary care doctor, they no longer take your managed care plan. Well, that's something that we could help you sort of immediately with. And we also handle quality of care concerns. And so an example of a quality of care concern would be wrong treatment, misdiagnosis, poor discharge planning. And so we would need an actual medical record with a quality of care complaint. Let's say you had a doctor and they had poor bedside manner. That wouldn't be something that KePro would handle, again, because that wouldn't be in a medical record. That would be something you would want to address directly there at that facility. Or there's other, patient advocates that can help you with that. But we also handle quality of care complaints. And so what we do is we're gonna, or one of our peer reviewers, one of our physicians is gonna look to make sure medical standards are being met, okay? And then lastly, we have a patient navigation program. Now, while the discharges and those types of appeals, those are available to either original or managed care plan. The patient navigation is only for original because with your managed care plan, you guys will have some options for that. So our patient navigation is just strictly for the original. So I wanted to go over a little bit about these notices. So when you're in a hospital, you're gonna get what's called an important message from Medicare. And what that is telling you is that you are going to be discharged and you have the right to appeal. So how many of you are Medicare beneficiaries and have been in a hospital setting? How many of you realize that you signed that? Exactly, and that's a common thing. You get a lot of paperwork, you're signing a lot of things. So that's why we help kind of educate you guys about this so you're aware. And so you're going to get that important message actually upon admissions and then prior to you leaving. So they're going to have to give you that again, so say within, generally speaking, 48 hours, but they could give it to you on the day of discharge. And the thing that you guys want to recognize is really important with any type of appeal process is timeliness is very, very important, okay? So when you're in a hospital and say, you're going to get discharged, they'll also give you a detailed notice why the physician thinks you should be discharged. If you disagree with that for whatever reason, you have the right to appeal. And in the state of Colorado, you would call into our helpline. And then we would be able to, process that appeal for you. And so once you call into the helpline, then we're going to request medical records from that facility. They're going to send that in, and then a peer reviewer will look at that. And then someone will call you with the determination, which is going to be one of two things. Either they're going to find in your favor and say, yes, we agree, and you shouldn't be discharged. Or two, no, we find in favor of the facility, and then we think you should be discharged, and that's usually noon the next day. So if you're in the hospital, you get the notice, you want to make sure if you do disagree and you want to appeal to do that before midnight, the day you're supposed to be discharged. Now, if you have any questions about that, you guys will have like case managers, or if you wanted to call in to KePro, you're always welcome to do that. But just remember, in a hospital, if you get that, just call in sooner than later, okay? Now, when you're in a post-acute care facility, similar process, right? You're going to get a notice of Medicare non-coverage. This says, hi, your services are being terminated. Again, you have the right to appeal that, but you want to appeal that noon the day before services are going to be terminated. And the reason why you want to make sure that those are timely in either one of those, either hospital settings or in these post-acute care settings, is there's financial liability if it's untimely. You can always appeal, but if it's not found in your favor, then any time that said you needed to be discharged, you could potentially be responsible for that. Now, while KePro is looking into your case, while we're reviewing it, that will be covered under Medicare. But once we give you that redetermination and says, yes, we think you should be discharged, usually it's going to be noon the next day, anytime you stay after that, you would be financially liable for that. So that's just something to keep in mind. Now, you guys will get a case number. And if you wanted to see, okay, what's happening with my case, you can go online, you can type in the case number, and it will also give you that information of when does my financial liability begin. So then you're aware of, okay, what's the time frame around that, okay? Now, as I mentioned also, we also have what's called immediate advocacy. So if things are just kind of coming up in the healthcare process and your care transitions or anything like that, you can speak with one of our social workers, and they'll be able to, help you sort of more immediately in that. Or let's say you have a question, on one of the, your the important message or the notice of Medicare non-coverage. Again, they can kind of explain this, what's happening in the process, why you get this, and so they can answer any of those questions. And so the last service I want to talk about is our patient navigation program. So again, just a reminder, that's just for the original Medicare. And an example of that, so say you're in a hospital and you're being discharged, and say they're having trouble finding durable medical equipment, or again, you can't find a provider, or something along that nature. Anything that comes along as soon as you hit the door of either setting and that comes up as an issue, you could then work with one of our clinical care coordinators. And this is going to be over the phone, and they're going to help you to eliminate the barriers that you may be facing. And say you have questions about, whatever, illness, say you're diabetic and you have questions about that, they're going to be able to also explain, your treatment and how you can best take care of those needs. And those are just a few examples. Certainly that's not exhaustive. So just think, if you're having any healthcare issues, care transitions, what have you, this patient navigation is available to you all. I want to thank you for your time.
Okay, Shannon, don't run away. Got to catch it on the run. Hold on, Wilma. Let me get the microphone to you.
Are there any advocates for the Medicare Advantage programs?
So you will have options. Maybe Kim or Dennis can speak to that.
So advocates for Medicare Advantage plans? Clarify the question, advocates for Medicare Advantage plans? Yeah, so in the Medicare Advantage world, if members have concerns or questions or issues that they're not getting resolved in their Medicare Advantage plan, or concerned about the amount you paid for a service, or questioned about why was my service denied or not covered, number one, we always encourage people to go back to the plan. And if the plan is unable to resolve that, and you can have various mechanisms, you can file a complaint with the plan, or you can appeal the decision. We look at those decisions. Ultimately, if your issue is not resolved to your satisfaction, you can report that to 1-800-MEDICARE. That's entered into a complaint tracking system. It's going to go back directly to the plan. CMS looks at that. That all goes back into that quality rating system that I talked about as far as scoring plans and that star rating. As far as how well is a plan resolving issues. Sometimes you're never going to be maybe happy with the decision, but that it was resolved satisfactorily. That's what we looked at. So yes, there are advocates. We always encourage you though first to go back to the plan, then report it to 1-800-MEDICARE. If you're still unsatisfied, the SHIP can help you also with those issues too, and they'll bring them to our attention if they're unable to resolve them at their end. But there are always resources for that.
Okay, so this question is for Shannon. Let's just say I'm in the hospital and I get the notification that I'm discharged, but I'm not able to call on my behalf. Can someone else call for me?
Yes, that's a great question. So yes, you can, as a Medicare beneficiary, have an authorized representative. CMS does have a form that you would have to sign and say, you know, hi, I want to make my husband or my friend, my neighbor, my authorized representative. And once you sign that, then that person that you designate can then call in on your behalf, and then KePro would talk and work with them.
Are there any other questions for Kim?
Let's say that the reason you're in the hospital is because you've lost your ability to communicate and you didn't designate an authorized person prior to going to the hospital. Now, who can speak for you?
Oh, that's a really great question. Can you guys speak to that? I really can't answer that. Okay.
The person couldn't communicate and pick an authorized representative, so now what happens?
If the person can communicate and didn't authorize an authorized representative ahead of time, or the family didn't, what's the issue, though?
How do they get their perspective presented to anybody if they can't communicate personally and they had not yet designated an authorized representative?
So Medicare always will have, if it's at the time of the services, if it's not, and a lot of times we want that there's mechanisms within the hospital as far as notices, and if the person is incapacitated and going to be unable to read the notice, then hopefully there's a family member or a loved one or a friend assisting or able to act on their behalf to question the services. But as far as like discharge notices or level of services being reduced or they're being discharged or something like that, hopefully not only the healthcare system, but that they have they have friends and family that might be able to assist on their behalf in that situation. And then after the fact, if it's outside of the hospital, and we always want it to be addressed, if your particular example is a hospital situation, we always like to get those addressed before discharge occurs. But there's always an appeal process, and there's five levels of appeals that Medicare beneficiaries, whether in original Medicare or Medicare Advantage or prescription drugs, have the option to appeal and have those decisions reconsidered after the fact because of a particular situation. Maybe it was a communication issue. But regardless, there's always that appeal process and resource as well.
Sure.
I was going to grab that.
So maybe just to your point though is you can always do that ahead of time. Fill out that form, and then we can keep that on file. So there's a little being proactive on that level. If you've assigned a durable medical attorney, then they would be able to speak with that person. But if you came in and they didn't know that, you would want that friend or family member to be able to advocate to say, oh, this is actually who I designated.
Any other questions? Coming to you.
I have had my Medicare and TRICARE and prescription drugs all established and running well for quite a while now. And I hear about all of these changes or opportunities, or I'm not sure why I would want to change it, or if I need to change it, or is it a requirement that I change it?
So Medicare and TRICARE for Life is great coverage. Is that what you're describing? So you don't want to look at changing unless you have a reason to, right? We tell people always, if you like what you have, that's fine. You don't have to change. We're just giving you other options. So unless something happened with your TRICARE and then we're going to sit down and say, okay, here's your other options, here are the pros and cons of a different choice. But don't ever feel pressured to change just because everybody else is doing this. Because original Medicare and TRICARE for Life is a great combination.
But are there any changes that are obviously appropriate or would be more important to change? Are there any changes that are obviously, improvements? Otherwise, I haven't.
Here's how I would address that, and Kim answered a piece of that earlier when she was talking, and that is, number one, if you're happy with your coverage, and you've checked, and how you would check is if you're an original Medicare, check in the Medicare, check and be sure and pick up that Medicare and You handbook. If there are any significant changes, usually in the front few pages, there is going to be notices of what those changes might be to the Medicare program. If you're in a Medicare Advantage plan, as we said, there's going to be an annual notice of change. And that annual notice of change is going to zero in on how my health plan is changing from 2018 to 2019 so that you can zero in on and say, wow, that's of concern to me. I might want to actively compare. But if you have checked those two resources and you don't see anything significant and you're happy and things are working well, then there's no reason to change. If you've got great coverage, it's working well from you, you have experience over time, that's great, that's wonderful, that's what we want to hear. And we want everybody to have that peace of mind too on an annual basis. But those are the tips that where you are going to get the information, and that's where we want you to check.
Goes along with what he's saying. I have my card with me, and I can't tell if I have Medicare Advantage from this standpoint. Is there any way to tell on the card itself?
Is it a red, white, and blue card?
Yeah.
That's a Medicare.
Right.
If you use that at the doctor, you don't have it in there. Yeah. If you use that red, white, and blue card when you go to the doctor, you don't have an Advantage plan. If you have an Advantage plan, you're going to be using that plan's card in place of your Medicare card when you get services.
And remember, in a Medicare Advantage plan, a prescription drug plan, a Medicare supplement, which we haven't talked about in great detail, these are all private companies. So you tell us that you're enrolling in that company. Otherwise, you're going to be in original Medicare. And once we enroll for the first time in Social Security, and everybody knows to get to Medicare, to enroll in Medicare, is through the Social Security Administration, we can't pretend to know which plan is right for you. That's why you're always placed in original Medicare. Original Medicare uses that red, white, and blue card. Only you could tell us XYZ Medicare Advantage plan is perfect for me based on the comparisons I've done. You would have to tell us that and make that active election to enroll. Or ABC prescription drug plan is the right plan for me for the drugs that I take and the pharmacies I use. You'd have to actively enroll in that plan to get there. Otherwise, you're in original Medicare.
I have insurance through a company I used to work for as a secondary, so that's probably why I'm where I'm placed. Is that correct? Kind of, or?
Very well could be. You're a fortunate one. So she says she has insurance through the company she used to work for. Fantastic. And some people are very fortunate to have retirement coverage through their former employer. And if you have that type of coverage, please don't do anything until you understand how it works for Medicare. And sometimes those companies will contract with a Medicare Advantage plan or a prescription drug plan to provide those benefits to you through your retirement. Always make sure you follow those rules and information and understand how Medicare works with that insurance too, but check with your former benefit specialist in your situation to make sure that you're following the rules. Sometimes in your situation, and I just have to say it because we see it now, and Kim will say the same thing, is that possibly that coverage has gotten so expensive that maybe going to just original Medicare outside of your contracted health benefits or drug benefits, it might be a better deal, and we can look at that. But always, 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 before you do anything with retirement coverage that you worked a lifetime for, check and make sure what the rules are and follow those to the T.
And then when you're considering moving between original Medicare and Medicare Advantage, just there's certain times you can do it. Don't always assume when you make a change that you can go back to what you had. And I'm thinking specifically if you go to Medicare Advantage and decide to go back to original Medicare, you can't always enroll into a Medicare supplement. So if you are looking for a true Medicare supplement to go with your Medicare, there are times when you are guaranteed issue in the state of Colorado to get that, and then down the road you may not be able to get that plan back. So before you make changes of any type, whether it's about your TRICARE, whether it's about your retirement coverage, whether it's moving between, it's always good just to make a quick phone call and say, I'm thinking I'm going to do this. Is there any reason I should, or anything else I should know about my decision, right, that I'm not aware of?
I have a question. I'm on original Medicare, and then I have a supplemental plan. Okay, so my husband and I are on that same plan, and then we got a letter from the carrier for the Plan G, and I did a comparison, and I picked, including my own plan, 3 other plans, and the 3 new ones were lower, and so was my own carrier. If I go on the same plan that I'm on now, but if I go on as a new person, cancel my Plan G, go back on, it's $10 difference for me.
I don't like the sound of that. No, we should talk. You should call me and we should talk about that. Okay. That sounds like somebody trying to get a commission to me.
Well, I called
Right. It's
Mutual of Omaha
Yeah.
and
Oh.
talk to the rep.
Well, Mutual of Omaha is no longer going to be selling Medicare supplement plans in Colorado.
Really?
Really.
They did not even say that on the phone.
Yeah, that's a new happening just recently. So I'd be interested in seeing your letter because it concerns me. That doesn't sound right to me. That something else
And
is
I
happening.
even asked him, I said, does this new rate include the 7% discount because we're both on the same plan? And she said yes. And I said, well, how can that be when you're offering a Plan G at the same age that we are for $10 less
No,
for me?
I'm gonna give you my phone number, and I want you to call me, and I want to see that letter because
Okay.
I'm really concerned about it.
Okay.
Yeah. Yeah.
Aha, mystery. But to follow up on that, anybody that has that plan already, even though Mutual of Omaha is not going to continue to sell, they can still keep their plan if they want to, right?
Right. So there's been quite a few companies exit the market in Colorado this last year, I would say, more than I've seen in the past. They don't have to sell here. But yes, if you already have a plan, you can keep it. It's guaranteed renewed as long as you pay your premium according to that arrangement, and you can keep it, and it'll be a little challenging to change. So folks say, well, this might be my opportunity. Maybe I want to pick a different company. Maybe I want to do something different. So just know that once you're in that Medigap plan, depending on what your situation is health-wise, you may not be able to just buy another plan with another company. There is no guarantee issue. Right? There's only a few times that, and a few reasons you would be guaranteed an issue of a Medicare supplement. And once you have it, they can say, no, we're not going to sell to you. And that's pretty much a national thing. That's not just Colorado. So we need to talk about that if you want to. Sometimes they'll let you move within to a lower benefit plan, right, within the same company. Again, get all of that worked out. If someone's promising you can change, especially if you're changing companies, get all of that in writing from them. Because if they've said something wrong, we got to be able to help you get back to where you came from. And we usually can, but as long as we have proof, yeah.
And just to clarify, right now, we're talking Medicare supplemental insurance. So we're not talking Medicare Advantage, we're not talking prescription drugs, we're talking Medicare supplemental insurance plans too.
Very good.
Can I just say that there's, to really clarify with the visual, for those of you who are visual folks, in your Medicare and You book, there is a chart toward the front of that book that has 2 columns, and you either go down the original Medicare side, Part A, Part B, and it says Part D underneath that, which is the drug piece, and then there's a Medicare supplement at the bottom, right? Or you choose the other path, which is a Medicare Advantage plan, which combines all of that coverage, like that coverage, right? And gives you, here's a private insurance company that's going to give you coverage for all of those things that would be covered in pieces on that left-hand column. So you're in one side or the other. And what we're cautioning you is when you're skipping back and forth, you can sometimes do that, but not always get all the pieces back, I guess is what I'm saying. And maybe you can get them back, but not right now. You have to wait to a different time to do it, that kind of thing. So ask lots of questions before you make changes.
Great question. Okay, I think our speakers are going to be hanging around for just a few minutes after we close. So we're coming to the end, but I do want to make a few announcements. The Seniors Council has educational presentations almost every single month at our meetings, the first Thursday of the month. So next month we have our end of the year wrap-up, and that's going to be at the Philip S. Miller Building the first Thursday at 10:15. And we're going to share that meeting with the Douglas County Transit Solutions folks. We're both going to give you an overview of what we've accomplished this past year and what we have planned for next year. So we invite you to join us there, and we'll have a holiday reception after that. And then also we have available the meeting schedule for the first quarter of 2019. Val, those are on the table out front. Is that correct? Yes. Okay, so we already have our presentations lined up for January, February, March of next year. Please help yourself to one of those schedules so you can see where we're going to be and what we're going to talk about. In January, we're going to be at Bonaventure, and we have Nathan Estrada from Nimble Science coming in talking about preventing fall risks. Then we also in February have J.J. Jordan talking about dementia and the new research relative to that, and we'll be at St. Andrew's United Methodist Church in Highlands Ranch. And then finally in March, we're going to be at the Pine Grove Crossing in Parker, a new assisted living facility. It's a beautiful facility, and we're going to have Shannon Basher from the DC Libraries talking about the health benefits of reading. Now, in addition to all those, we have a fabulous day-long educational event coming up next May called Vintage and Vibrant. We had our first Vintage and Vibrant this year in May in Castle Rock. Next year, we're going to have it at the Pace Center in Parker. This is an all-day event. There'll be breakfast, there'll be lunch, there'll be keynote speakers, 9 breakout sessions on 9 different topics, experts coming in and explaining to you the latest and the greatest and the cutting-edge technology, as well as the health benefits of many different things. So we invite you to that. Pick up a flyer, the save-to-date flyer. Put it on your calendar. We'd love to see you. And thank you for coming today, and let's give our panelists a warm round of applause.